like I just stated, D'Angelo's death has deeply affected so many people. So, from your perspective, what does his passing reveal about the broader cancer risks facing Black men? And what conversations do we need to be having right now about this?
Yeah, this is, so tragic for the culture, obviously for his family. Um, it really brings to the light how we really have this epidemic of elevated risk of cancer, but even more profound than that, elevated risk of dying that we see in Black men and women too. But for the sake of this conversation, we're talking about Black men. We know, it's October, it's breast cancer awareness month, so we know Black women are more likely to get breast cancer. We know how many women in the US are likely to get breast cancer in general, but a lot of times we don't realize that that risk for men, and Black men in particular, matches what we see with women with breast cancer, but it just doesn't get that same focus and attention. And so unfortunately, men tend to be a little bit more private about their health, and even just going to the doctor and discussing their family history and talking to loved ones, and knowing their health history for themselves and their family. And so when you don't have when you're not as open or having those conversations, sometimes these risks are not communicated to the doctor in time. And I'm not saying that that's what happened in this situation by any stretch of the imagination, but we know that that happens in general. It happens with the men in my family. Okay, so I'm just going to speak for personal experience. It happens with my husband, with my dad, and so it's really important to know, first of all, that you are at higher risk, so that when you're going to the doctor's office and having these conversations about screening, that you're getting the appropriate test based on your personal age, your personal race, your personal family history.
When it comes to prostate cancer in particular, Black men are far more likely to be diagnosed and to die from the disease than white males. So, what are
Mhm.
some of the key factors driving these disparities? And are there more biological, are they more biological, social, or a combination of both?
It's a combination of so many things. If there were just one thing, I could have retired by now. But there's so many different angles to this, and it's always important to lead a healthy lifestyle as best as we can for all diseases. But what I like to point out is there are definite biological contributing reasons why certain men are more likely to get prostate cancer than others. And we're talking about Black men specifically in this case. A lot of cancers tend to be hereditary. And so we know that there are DNA genetic variants that are linked to West Africa. And Black people in the United States, a lot of our DNA is traced to West Africa, due to the transatlantic slave trade. And so you can do everything right. I tell people you can, eat the best, work out all the time, get your water, get your rest. And at the end of the day, we can't change our DNA. So, yes, you want to lead a healthy lifestyle, but you have to keep that in the back of your mind, that some of these cancers that we know are driven by variants in genetics, that you want to know that you're at that high risk, and you can do everything possible, but that does drive a lot of these differences that we see. But that's just in terms of your likelihood to get prostate cancer in the first place, right? Prostate cancer is highly curable. According to American Cancer Society, there's over a 99% survival rate 5 years out if you detect it early. The problem in the US is screening recommendations are not designed for Black men to be tested early enough for a lot of men where they can be cured. And so then by the time you find out, you're further along and the treatment options are a lot less. The standard right now for screening for prostate cancer is a PSA test. And also, the long word for that is prostate specific antigen. And it is a biomarker that circulates in the blood when your prostate has inflammation. So when you go for your annual visit to the doctor and you get this blood test, which should be included along with your panel where they're checking your cholesterol and your glucose and all the other things they're checking in your blood work. This is a number that if it's elevated, it does not mean you automatically have prostate cancer, but it is a red flag to, let's come back, let's follow up, let's see what's going on with this PSA number. And if it keeps rising, let's decide if we want to do a biopsy or something along those lines. And so, what we know is that our screening recommendations in the country are based off of research studies that take into account hundreds of thousands of individuals. So these are very large scale studies that the U.S. Preventive Services Task Force comes together and looks at these studies and dissects them to decide how these recommendations should look for the nation. But what we also know in the history of the U.S. is oftentimes Black individuals or people of African ancestry are not included in these pivotal studies. So then what you have are these recommendations that are meant to apply to the whole nation, but you left out the populations that are more likely to have worse outcomes. And so what happened was in 2012, the task force recommended that we stop doing PSA testing every year in the clinic. That was all over the media, that was all over the news. I remember being a student at that time and thinking, a lot of men are pretty excited about this because they're thinking they don't have to have any prostate screening tests. But this is really bad for Black men. I remember thinking that my dad had just been diagnosed with prostate cancer at that time, and he was 50 and it was already aggressive. And I thought, now they're not even screening at all. This is kind of crazy. And so what happened was in 2017, the task force sort of backtracked and said, well, let's consider having a discussion with your primary care physician at age 55 regarding should you be screened or not. So not even saying you need to get screened, but just have the conversation with your doctor as to whether you should be screened or not. And that's at age 55. Again, not taking into account that Black men are more likely to be diagnosed with prostate cancer in their 40s. So there are certain organizations such as American Cancer Society, such as Prostate Cancer Foundation, who recommend that Black men begin screening at least by age 45, right? But if you are Black and you have family history, you have a dad, you have a brother, you have an uncle, then you really need to start getting this PSA blood test at age 40.
And of course, my notes here say that you've been doing some incredible work connecting Black men with free PSA testing and education. And
Yes.
so, yeah.
I'm very passionate about that. I did that. I lived in Southern California for a decade and co-developed a program along with Dr. Rick Kittles out of Southern California at the time where we were providing PSA testing at no cost to Black men and other men who are in high-risk populations in that area. And then we both moved to Atlanta, Georgia in 2022. We're both at Morehouse School of Medicine, and we developed a program called Prostate Cancer Precision Prevention Program. So that's a mouthful, but the shortened term is PCP3. And we have a team of about 50 individuals where we go out and we provide PSA testing at no cost. And there's a lot of groups who are sort of jumping on this bandwagon now, and it's really it's exciting to know that this awareness is spreading and all of these things. But I am very adamant in letting people know when you're developing these type of programs, you have to make sure that there's follow-up. It's not enough to go out and say, hey, we screened 1,000 men and pat yourself on the back and do a news article and, have the footage and all of these things. What happens to the men afterwards when their numbers come back elevated? What happens if they don't have insurance? Where are they going to go? So you want to make sure that you provide these sort of options. And so when I have developed these programs, it really takes about a year's work ahead of when you actually start screening to make sure all of those clinical partners are in place.
There's often stigma or silence around men's health, especially in Black communities, right? So, in your opinion, how can we start breaking through that? And what role can family or faith, communities, or even public figures play in changing that culture?
I'm so grateful for those who are in the spotlight who have chosen to share publicly. And it's a personal decision. So those who want to be private, that is definitely their decision. But for those who are deciding to go public, it's really raising awareness where other men are able to see, like, oh, wow, this person is 45 years old and they have cancer. Like I just never would imagine. And what kind of test did he say that he got? And, we look at Montel Jordan with his prostate cancer diagnosis. We look at Deion Sanders with bladder cancer. It's in the way that social media is set up nowadays, there's just more of an opportunity to have a broader outreach with men who are coming out with their diagnosis. This is not something that is unique just to the United States, right? So I was recently invited to visit Liberia in West Africa this year and brought a team over there to really partner with urologists over there in terms of increasing and elevating health outcomes for men with prostate cancer there. And what I learned there is it really looks like what it looks like here, which is men don't like to talk about it. Men don't want to know about it. Men don't want to, they're afraid of the side effects that come with a diagnosis or that come with treatment. And so, a lot of times we just think if we don't talk about it or we don't follow up on it, that maybe it's not happening. And especially with prostate cancer, because what we do know is, unfortunately, there are not symptoms for early prostate cancer for the vast majority of men. So by the time my dad found out he had prostate cancer, it was already aggressive. It had already spread. He literally had zero symptoms. He found out on accident due to going to the ER from complications from something totally different. And they were like, what's going on with your blood work here? While you're here, your prostate levels are looking a little suspicious. And so a lot of men don't have symptoms, or a lot of men, they attribute symptoms that they're having to just getting older, because what we do know is that for men, as they grow older, their prostate grows larger. Prostates become enlarged, and that can cause men to have more frequent urination, especially at nighttime. And so, that can be a benign condition of just your prostate getting, larger and you're getting older, or it can be a red flag that something else is going on. So whenever you're having any sort of symptoms that are just different than the norm, it's just important to follow up on that.
So my notes here say you're part of a medical advisory board at Zero Prostate
Yeah.
Cancer, which has partnered with figures like Montel Jordan to raise awareness. And you
Yeah.
just talked about the importance of, celebrities and personal stories.
For sure. So I can't thank Zero Prostate Cancer and their major funding partner, Novartis, enough for the spotlight that they've put into this initiative they have right now. It's called Blitz the Barriers. And the whole purpose of this initiative is to improve health equity for Black men at risk for prostate cancer. And they're they're honing in on cities in the United States where we know the rates are much worse than other parts of the country, and Black men are more likely to die in certain regions and certain cities of the country. And so for people like me who've been concerned about prostate cancer in Black men for well over a decade, I feel like we were sort of, climbing this uphill mountain and working in silos. And we know it's important, but it was hard to get the word out. And so when Zero Prostate Cancer really decided to focus on this very important issue, this epidemic that's going on right now, and to receive funding like that and support like that, what it's allowed is for this to become a national conversation, even the conversation that we're having now today. These opportunities weren't necessarily available a few years ago. And so there's a push by Zero Prostate Cancer, not just through the media, but when we're talking about, sports, entering into the sports world. I don't know about the men in your life, but the men in my life, it doesn't matter if they're 5 years old or 85 years old. They're literally, they're going to watch the football game. They're going to watch the basketball game. So any opportunity that we have to partner with athletes, partner with the NBA, the NFL, or these sorts of conversations that are happening right now with Zero Prostate Cancer and Novartis, are just a tremendous opportunity. Like I said, it's Breast Cancer Awareness Month. My son, he's on the varsity football team in high school, and he said, Mom, I need my pink this and pink that because we have to do the pink out on Friday night. And I said, you know what your mom does in the prostate world? You were not asking me for any blue things in the month of September. So, we still have a way to go to raise awareness, but I can see us definitely trending in that direction.
Is there anything that gives you hope? Are there any new treatments or technologies or community programs that can help close the gap and save more Black men's lives in the next decade?
Yes. Okay, so I am a scientist by trade, right? So I do the community outreach and all of these things for sure, but I do run a lab out of Morehouse School of Medicine where we look at the genetic and the molecular reasons why Black men are more likely to get aggressive prostate cancer. And the goal is to develop treatments that can work for all populations, but it's my goal to have them work for populations that are at the highest risk for worse outcomes. So we're talking about Black men. And surprisingly, it wasn't until 2018 at an ASCO annual meeting where some results from clinical trials came out showing that if you enroll Black men in these clinical trials where you were looking at the effects of chemotherapy, the effects of hormone therapy, the effects of immunotherapy, that not only did Black men respond to these treatments just as well as other populations, they actually had better survival outcomes. So this was amazing. Now, 2018 just was not that long ago. So realize that before that, there was not necessarily a push to make sure that we had all populations included in these clinical trials. So that sort of kickstarted the thinking of other labs to think, wow, if Black men are responding better to this drug and this drug, I wonder if they'll respond better to this drug. And so it's important when we're developing drugs to really factor in the role of genetic ancestry and how our bodies respond to treatments. We know this with blood thinner medication when we look at the history of warfarin and how it works in some populations versus others. We know in some lung cancer treatments, people of Asian descent respond differently to certain medications than others. And so it's no different when we're talking about prostate cancer. So at the bench, when I'm looking at the mechanism of action at a certain drug, and I'm looking at the prostate cancer cell in the lab, and I'm thinking what receptors are more likely to be expressed that are linked to West African genetics, right? Then we can really tailor medicines that can work best for men who have more aggressive prostate cancer, and in this case, Black men. And so that's what we call in the science world precision medicine. The goal is this is not, a preferential treatment. This is the goal of medicine, right? We want each person to have the best outcome for a complete and total cure. And so that only works if we're considering all populations at the beginning in the experimental design, and then next when we're in the clinical trial, and then next when it's in the clinic. So there has been more of a focus on that in the past few years, and I'm really excited to be part of that movement with my lab as well as other labs working on this around the world.
Very good. Doctor, one last question for you in closing, because this conversation has been very, very informative and I feel educational. If there's one thing you could say to Black men watching this interview, one thing you could say to them about taking charge of their health, what would it be?
Okay, well, it has to be two things. The
Yes.
first thing is please go to the doctor annually. Don't wait for something to hurt. So just go annually. The women in your lives are more likely to do that. This is documented. I'm not just saying, this is documented. So we need men to go to the doctor once a year. So that's the first thing. But the second thing is, do not assume that your doctor is ordering all of the appropriate tests for you. Unfortunately, I've published on this in the past, and this is documented for other diseases as well. But in terms of prostate cancer, I published that 54.8% of Black men, when they go to their doctor once a year, their doctor is not talking to them about prostate cancer screening. So that's a problem. So when we're out in the community, we hear so many times men will say, oh, I went to the doctor last month. They'll literally pull up their phone, they'll pull up their app, they'll show me, look, I went to the doctor, I got my blood work, and I just scroll through real fast and I said, oh, they didn't check your PSA. How old are you? You might want to circle back. So just don't assume that you're going to the doctor and they're factoring you in, because keep in mind, like I said earlier, they're following these national screening guideline recommendations. And so, for better or worse, a lot of these institutions, it's showing in their system 55 is when to start. But I'm telling you today in this conversation, if you're a Black man and you're 45, or if you're 40 and you have family history, bring that up with your doctor. And if he gives you pushback, because my husband and I were in one doctor's office one time and received extreme pushback to get a PSA blood test. That was our last appointment with that doctor. And we found another one that this wasn't going to be a tremendous issue to add a PSA test along with other testing. And that goes for any sorts of cancer screening. So it's just really important to advocate for yourself. Find a doctor who knows your family history and knows the risk for Black people in general that may be different than others.
Right on. Thank you.